Hello, my name is Nicholas Okiro. Today I'm going to demonstrate a skill on NG tube insertion and the ostomy care. So first of all, I'm going to check on the PCV orders and the patient care plan to confirm that there's an order for that. So assuming that I've checked on the PCP orders and the patient care plan, and I found that there's an order for NG tube insertion, so I'm now going to begin my skill. First of all, I'm going to gather all the required supplies for the NG tube insertion. Right here, I need a dual lumen stomach tube, a tongue depressor, my little small towel, a clip, a pen light, a pair of scissors, a tape, and then this one is MSC spacing, a glass of water with water and straw in it, and this is my water soluble lubricant. This one also here is my little mannequin, which will be my patient, and the pad. So with the tape, I need 3 pieces. I've already prepared 2. One is about 1 inch little tape that I'm going to use to mark how far the tube can go into the patient. Another one is about 2 inch I'm going to use to clip the tube into the patient's gown. Another one is about 4 inch that I made like a pair of pants that I'm going to use to tape around the nose, the tube once I've inserted to the patient. So now I'm going to get into the patient's room, introduce myself, get to know the patient using 2-name identifier, then explain the procedure to the patient before I begin my skill. So I'm going to do hand hygiene first using hand sanitizer. Then I'm going to get into the patient's room. Knock, knock. Hello, my name is Nicholas Okiro. May I know your first, last name, and date of birth, please? At this point, I'm going to look at the name band. Password Jack, date of birth 0605-19XX. Password Jack 0506-19XX. All right. Then give Mr. Password. I'm going to insert NG tube into your nostrils to all the way to the stomach, and then later on I'll change your colostrum bag. Is that okay with you? All right. Mr. Password, one more question. Are you allergic to latex or medication or anything? No allergies? Oh, okay. So now I'm going to provide privacy to my patient, and then raise up the bed of the patient to my working level, lower down the side rail from the side on which I'm working. Then I'm going to raise the bed. I'm going to raise the patient's head into the full forward position, or to the comfortable position. Then after that, I'm now going to put on 2 gloves. Then I'm going to open my dual lumen stomach tube. And then to know how far this tube can go down to the stomach, I'm going to measure from the nose to the earlobe down to the xiphoid process. But because my mannequin is so small, I'm going to assume. So I'm going to take my tube. Then at the tip of the tube, I'm going to measure from the nose, assuming this is the earlobe, to the earlobe. From the earlobe down to the xiphoid process is about 20. So I'm going to use my little tape to mark around 20. Fortunate enough, then my tube is marked around 20. And then I'm going now to duplicate my tube. So before I do all that, I'm going to check on the patient nails to ensure that there is no occlusion, no drainage, no injury, no surgery. And then I'm also going to check on the gag. I'm going to tell my patient to cough, and I press down the tongue as I check on the gag. Mr. Pastor, can you cough for me? It's no gag. Then I'm going to protect the patient's chest using the towel. Then I'm going to put in here MSC spacing, and I'm going to provide my patient with water because I've checked on the PCP orders and I've confirmed that the patient is not NPO. Now I'm going to duplicate my tube about 4 inches, and then I'm going to tell the patient to hyperextend the neck. Then I'm going to begin inserting once the tube is up to the pharynx, and then I'll let the patient bend forward. If I feel any resistance, I will stop. And then I will tell my patient, Mr. Passer, if you feel any pain or any gag, please raise up your hand for me because you can't talk, okay? All right, at around that point, I'm going to tell my patient to begin swallowing. Can you swallow down your water, Mr. Passer, please? Keep swallowing. Keep swallowing. Good, keep going. Swallow. Keep going, please swallow. There you go, we're almost there. Swallow. Keep going, swallow. All right, now I'm up to the 20th point. So there, I'm now going to use my pearl pens like tape to secure the tape. So I'm going to wrap it around the nose like that. I'm going to secure this to the opposite direction, but make sure I don't obstruct the nostrils. I'm also going to use this other one, tape it around to the opposite direction, also making sure that I don't obstruct the nostrils. Then I'm going to test and make sure it's securely fastened there. And then because the patient might be tempted to pull the tube, I'm going to use my other 2-inch tape and then fasten it to the patient's gown using the clip. Now fasten this to the patient's gown. Then I'm going to make sure that the tube went all the way down to the required place, the stomach, by calling in the X-ray to confirm. So they will confirm by taking the X-ray. And then I'll leave the patient's room. I'll take off my gloves. And then I do hand hygiene, put down the bed all the way down to the lowest position. And then put up the sidearm, provide the call light, and tell the patient that I'll leave the room for about 30 minutes or so. And I'll instruct the patient to call me in case he needs me for anything before I come back. And then I'll leave the room. And then, assuming that now it's time for the G-tube to be removed as per the physician orders, come again, do the same procedure, like do hand hygiene, get to the patient's room, do hand hygiene. And then put on clean gloves. And then introduce myself to the patient, and I get to know the patient using 2-name identifier. Hello, Mr. Pastor. Hello, my name is Nicholas Okilo. May I know your name, please? And then at that point now, use the 2-name identifier. Jack Passard, date of birth 06/05/19XX. Check passwords 06/05/19XX. Then good. Then now I will explain to the patient that I'm going to remove the tube. It's gonna be a little uncomfortable, but I'll let the patient bear with me. So I'm going to raise up the bed to my working position, lower down the sideline, and provide privacy. And then I'm going now. At this point, I'm going to start by unhooking the clip from the gown, patient gown, and removing the tape from the patient gown. And then I'm going to start untying from the nose side, and then I'm going to gently remove the tube as quick as possible and secure the tube. I will observe for any mucus or any drainage, then record or document as per the facility procedure. Then I'm going to fold this, then discard it as appropriate. Then I'm going to clean up the patient's nose around the skin, and then make sure that there's no injuries, no skin operations. And then I'll make sure I turn the patient to the comfortable position, and then I lower down the bed all the way down, put the collar by the patient's side, and let the patient know that I'm leaving the room. Then I'll come back later in about 30 minutes after my break. But in case the patient needs me, before that, we'll put on the collar for me. Then I leave the patient's room. And that's the end of the skill of any cheat tube insertion. Next, I'm going to demonstrate on how to change the ostomy bag. Now with the ostomy bag, I'm going to check on the PCP orders and the patient care plan as usual, and make sure that there's an order make sure if there's any order changes. If there's no order changes, then I'm going to remove the bag that is there, clean up the area around the skin, and then apply another ostomy bag. So by me removing the bag, assuming with my patient the bag is not there, but the procedure is I'm going to pull tight the skin, and then slowly and gently remove the tape all around, then remove the bag, and then clean up the area. But I'm going to remove the bag. Before I remove, I'm going to empty it so that I avoid spraying around all the contents from the bag. I'm going to empty it into the commode. I'll unclip it, empty it into the commode, and then start removing. Then after that, I'll clean the area so nicely, pat it dry without wrapping it, and then I'll begin applying a clean ostomy bag. And now my procedure begins. I'm going to make sure I've got all the supplies I need: a towel, a pad which is already set, a clip for my ostomy bag, this is the ostomy measuring device, this is my ostomy bag, and the wavers. So I'm going first of all to measure the ostomy, assuming like I explained earlier, assuming that I've cleaned it. So I'm going to put on my gloves. After cleaning, I took off the gloves, so I'm going to put on the clean gloves. And then I'm going now to use my ostomy measuring device to measure the ostomy that I've already cleaned the surface. So I'll measure the ostomy. Look for this one. It fits around. Yeah, it fits around 1.5 inch. Now 1.25 inch. But I'm going to use a little bit big size, not more than 1/16 or 1/8 inch. So that's about 1.5 inch. I'm going to use 1.5 inch to measure, to check on my wafers, which is around the wafer is around up to 1.75 of an inch. So there's 1.5 inch. So I'll cut around 1.5 inch, and that's the one I'm going to feed into the patient after securing it in my bag. So so next I'm going to open my wafers. And then I'm going to get my little pair of scissors. Then I'm going to begin by cutting about 1.5 inch all around. Yeah, you see now I got 1.5 inch. So my surface is not smooth, so I'm going to smoothen with my finger because this one is and then it looks somehow smooth. So now I'm going to fasten my bag into the wafers. So I'm going to make sure to fasten it all around. And make sure it's secure. It's all fastened all around. And then I'm going to clip my bag using the clip. Now this one is not disposable. Whenever I come back to change the bag on another patient care nurse, we use this one. So I'm going to fold once. Fold once, then I'm going to clip it. Then I'll check and make sure it's secure. And now I'm going to put my bag to the ostomy. But here now I'm going to make sure put my towel ready. But here now I'm going to make sure the bag doesn't go towards the very area or towards the, if there is any wound on the skin, like on the thigh. So I'm going to be safe, I'm going to put it to the side for its cleaning. And then I'm going to make sure the ostomy fits. Then I'm going now to start untapping the wafers as I stick it to the skin of the patient. So I'm going to, there's a tape that I have to take out all the way around. stick this to the patient's skin. There are two tape protectors, so do the last one to secure it. Tape. Now, if you can check, the bag is secured to the patient's skin, and from there you can see the ostomy is inside the wafer. So after that, now I make sure it's secure. Then I'll ask my patient if the patient has any complaint, like any itching of the skin or any problem. Then I'm going to take off my gloves. And then do one like chin, as usual. Then I'm going to lower down the bed all the way down to the lowest position. Put up my side rail. Then put the collar by the patient inside. Then explain to the patient that I'm going to leave the room. And I'll be back in about 30 minutes. And ask the patient to call me if there's anything in between before my 30 minutes are over. Then I'll leave the room. And assuming that it's now time for the bag to be changed, I'll come back and do hand hygiene as usual. Wash my hands. Use my hand sanitizer. And then I put on clean gloves. And then I introduce myself to the patient using, not the patient using 2 name identifiers, assuming I've done so. And I've checked for, and I've checked the skin all around, checked for any scratches and anything that is like if the skin is red, because the stomach should be normally be pink. If it's not pink, any changes of the stomach. And then I'm going to empty the bag into the commode. And then once I've emptied it, so that way it cannot spill all over the pad to the patient. Then I'll put the towel close to the patient's stomach. Then I'm going now to pull out the skin as I peel off. As I peel off the tape. So as I pull out the skin to ensure that it doesn't tear the patient's skin, I'm going to go all around. Take out the skin, the tape, the bag, so that way I unclipped and I use the same clip to secure another bag. So I'm going to take out all this, all the gently and discard it, and then clean I'll change again gloves, then clean the area around the stomach, and dry it before I put on another clean bag, and then put in another clean bag using the same procedure that I did earlier. And then after changing the bag, I'm going to leave the patient's room. As usual, put down the patient bed all the way down to the lowest position. That's the color by the patient side. Then let the patient that I'm going to leave the room, and then I've done in about 30 minutes, and then leave the room. And that's the end of my skill. Thank you.